improv theater offers more than just laughs. It's also a powerful tool in mental health therapy. Today, we're joined by Yehuda Alcabes, a licensed clinical social worker and therapist who uses improv techniques to treat various mental health conditions. Yehuda, welcome.
Hi, how you doing?
So I am so curious. I love this story. I took an improv class years ago, but I never would have thought that it would be used in therapy to treat things like anxiety and depression. How did you start doing this?
Yeah, it's absolutely crazy. I took an improv class just on a whim. I took a day off from work just to clear my head. I was looking for something to do. I took an improv class, and when I walked into the room, I felt a certain energy that was, but I think I've been searching for a long time, which was it's totally fine to just make mistakes and screw things up in here. And then as we went along, I started to see that there were so many different types of people that were improvising, and they were finding their own style and different ways of doing it. And I just got super excited about it. And I was like, maybe I could start using this in my therapy. And I tried it, and now I'm all in on it.
Wow, can you give us some examples? Like what kind of feedback have you gotten? What kind of results have you seen with clients? What kind of conditions are you treating?
Yeah, absolutely. So I use it in my anxiety group, and that was the first place that I used it. So when we're working with our anxiety and we're working with the irrational thought processes and where anxiety is holding us back in our lives, right? So we need a lot of information to understand how anxiety works. Now, what we know from anxiety treatments that have been tried and true is that experience trumps information. And that's true about most therapy. When you have an experience, an emotional experience, it's usually much more powerful than all the information stacked up together. And so what I started doing is I started using it in my anxiety groups, and I explained to them that this isn't going to necessarily feel comfortable right away. But what I found was people were starting to have an experience where they cut straight through their social anxiety and they immediately got the payoff of, oh my gosh, I just did that. I just created that from nothing. Hey, that was pretty cool. And I didn't have to overthink it. And I feel good about it. And then we kept repeating that over and over again. And it did much more for the anxiety than just talking about how anxiety works and how we can handle it.
I can kind of see that because you talk about, when you went into that first improv class where there was that energy of like, it's okay to mess up. We're just having fun and we'll figure it out together. So I can see how that's helpful with anxiety, right? Because there's so much of a fear of messing up. What about with depression? Tell me how you've used it with depression.
Yeah. So with depression, somebody who's struggling with depression will feel like I'm not worth anything and that there's nothing that's actually worth giving it a shot. Now, this is true with both anxiety and depression. Improv puts you in this situation where you're like out on a ledge with another person, just like, holy crap, what are we supposed to do? How are we supposed to make something up here? Right. But a lot of the theory of improv is that if you are present, then you will make something up. So the moment is kind of like, it locks you into this moment where you got to say something, and then you say something and it kind of works, and then you can't deny that experience. So then you're like, well, I don't know, maybe I'm more fun than I thought, maybe I can connect to people more than I thought. And then again, repeating that over and over again, it makes the social world a lot less scary for somebody with depression.
That totally makes sense. And I never would have thought of this. Now, you had also mentioned you use this with addiction. How does that
Yes.
work?
Yeah, addiction. That was such a fascinating transition. I did it in a treatment center for several months, and I now do it in my private practice. The thing with addiction is that when somebody's stuck in the addictive mindset, they are self-centered, and they're just thinking about how do I get what I want? How do I get my pleasure in my way? Now, what improv teaches is that you and the other person, or if it's more than two, the people there have to support each other. There's no way to make an improv scene where one person is just carrying the load the entire time because you're essentially both adding pieces to this reality, one little piece at a time until there's something complete there. And so, what I found with people, with my clients who struggled with addiction in the past, is that this was an opportunity for them to realize that it's not either you get or I get, which it would be true in, selfish situations. Is actually, if we both respect each other, then we both get, which is amazing. And I've seen it happen in real time where they're able to say, wow, I never thought of it that way, but this experience feels different.
Yeah, I mean, that's so true. And I feel like that's a lesson we can use just in life in general, that it's about cooperation and collaboration. So if somebody wants to try this therapy, like, are there other therapists who do this, or is it just you? What kind of resources are there for people who are interested in finding out more?
So I'm not aware of a lot of other therapists that are doing this. I did find someone in Naples, Florida, down here who has been doing this for around 12 years. And I see it popping up sporadically. There was an article on Fox News the other night about a speech pathologist who's using it with autistic children in New York. And so it's not necessarily widespread in the therapy space. There are a lot of improv theaters that are available in different towns and cities. The only thing I would say is, do a little research to make sure that it is a safe environment for, you to let yourself be that free. And that's one of the things that I really focus on, is that I'm blending my understanding of the issues with my understanding of improv so that I can make sure that it's always safe at all times. Unfortunately, some of the improv, places out there are more in the theater world, and in the, let's call it, the darker parts of the theater world where people get taken advantage of. So meaning just being cautious about that. But other if you're not don't have any red flags, I would say look for an improv class in your local community and just try it out. You got nothing to lose.
Mm. So, do you think like there are certain people who this might not be good for? Like, just something to consider as people are watching this and like, huh, I'd like to give this a shot. Like, what are the top three things they should consider before they think, okay, this might be helpful for me? I mean, are there certain like conditions or the severity of the condition which maybe they might need a combination of this and something else?
Well, not really. The only thing I would say is that, improv alone is not going to be solely therapeutic if there's a larger issue that's going on, right? So, really, with any mental health issue, we have to have a approach from different angles. Sometimes it's medication plus therapy, sometimes it's family therapy plus medication plus individual therapy, right? So, using it as a therapeutic tool, I absolutely think could apply to anybody. Definitely not looking at it as this is going to solve all of my problems if there's something very serious that's going on.
Mm. Yeah, I guess, but it's a great tool. I mean, just the examples you gave us, I can totally see how it can be effective. So you are a pioneer. Thanks so much for sharing this
Well,
with us,
not
Yehuda.
really. Not
No, you're
really.
not.
Viola Spolin did it in the 30s and she was a social worker. So, you
Well,
know,
you can be a pioneer now in this time.
I'll beat that.
Thanks, Yehuda.
All right. Thanks for having me.